All right. Hi, everyone. My name is Anjum Sultana. I'm the National Director of Public Policy and Strategic Communications at YWCA Canada. We're going to get started. There's a couple folks that are still going to be rolling through the waiting room, and my colleague Jennifer Lockerbie will be admitting them in. But we have a very packed agenda today, so we don't want to waste too much time. So I was mentioning we're here on behalf of YWCA Canada, and tonight we're going to be talking about community responses to COVID. This is actually the second in a series of webinars we've been hosting around gender equity during a pandemic. And tonight we're going to be hearing from incredible activists, advocates, and organizers around their experiences and hearing dispatches from the front lines. For folks who are using Twitter or have an account, we encourage you to tweet during the event. The hashtag for the event is reimagining resilience as well as gender equity during a pandemic. So you'll see that up top here. And also our Twitter handle is at YWCA_Canada. So please be sure to tag us and we'll be reading every single comment. So without further ado, I'll get us started. So first and foremost, we'd like to do a land acknowledgement to recognize the land that we're on, but also recognize how as settlers, we have benefited from colonialism and settler colonialism, and the disadvantages accrued by Indigenous peoples has resulted from this colonial violence from time immemorial. So currently, this presentation is based on the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the New Credit First Nation. Toronto, also known as Toronto, is now home to many diverse First Nations, Inuit, and Métis people. And also, what I like to also do during a land acknowledgement is highlight my own story of migration. So as someone who settled in Canada at the age of 6, I came to this country and this land. I was born in India and my family migrated to Saudi Arabia and Yemen. And later we came to this land and I've been here ever since. So also recognizing that immigration path that has led me to this land. So for folks on the line who've joined us, you may be familiar with our organization, YWCA Canada, and you may have attended actually our first event, which this current session will build on. But just so you're aware of who we are and what we do. So we are one of the nation's largest and oldest organizations focused on gender equity. We do national advocacy and community action. So we have local YWCAs in 9 provinces and 2 territories across this land. And because of that, we have a pan-Canadian perspective on issues that impact communities on the ground. And over the last 150 years, this year is actually our 150th anniversary, we've developed expertise in service delivery. And that's also what informs our advocacy work because we hear stories and issues that are impacting communities, and we use that to drive our action on Parliament Hill and other orders of government. And ultimately, we're really interested in driving systemic change, but that can happen without people, their stories, and the issues that matter to them. So tonight, we have a packed agenda from incredible activists and organizers who have been kind enough to share their time and insights with us. So I'll do a brief introduction of our panelists. We'll follow that up with each panelist sharing their insights on community responses to COVID. The next round after that, we'll talk a bit about the pandemic policies that have come into play during this crisis. The federal government has announced many different policies, but what is actually working for communities? The good, the bad, we want to delve into that. And finally, on a hopeful note, we want to reimagine the future. We talk a lot at YWCA Canada about policy windows, and we see this as one of the biggest policy windows in the last number of decades. So how can we use this moment to build back better and put, for us, a key piece of the puzzle is care and putting care at the core, but what else should we be thinking about as we move forward past this crisis? So without further ado, I'll introduce our panelists, and they'll also share a bit, and also I'll share a bit about how I've come to know each and every one of them. All right, so how are people feeling? Good? Okay. Alrighty. So in terms of our panelists, so I'll start off with my friend and colleague in the movement for gender equity, Jessica. So Jessica has a Bachelor's of Arts from Ryerson University, and throughout her career there, but also currently, she has put gender equity at the core of her work. She has worked in primarily the nonprofit sector and has done a lot of work around economic justice for women in Canada. And currently, she works at Women Abuse Council of Toronto, and she works there. She's there as a project coordinator, doing a lot of important work around addressing gender-based violence. And we're really privileged to have Jessica be part of our national leadership program. So Jessica has started this year, and so we're really excited to hear her perspectives on COVID-19 community responses. Next, Karen from Migrant Rights Network. So we have, this is the first time I'm connecting with Karen, but I've heard a lot about her work, but also the work of her organization, Migrant Rights Network, which is Canada's largest migrant justice coalition, and she has been the national coordinator for some time. She also does a lot of work with Migrant Workers Alliance for Change, and I think what we're really interested in is hearing her perspectives on how this crisis has hit migrant communities. So she has lots of experience in migrant justice, anti-poverty, and labor struggles for the last 2 decades, and she's currently based in Ottawa. Next, we have Rosalind Gunn, also known as Roz, and we were joking earlier this week that it's our 1-year anniversary. So I actually just knew her about a year ago, but we've become fast friends. She's the Director of Marketing and Communications at YWCA Cambridge, one of our YWCAs across the country, and she has worked immensely in the post-secondary education as well as the labor movement. She has a bachelor's in English and political science from the University of Waterloo, and also a master's of arts in immigration and settlement studies from Ryerson University. I think what I'm really interested in her perspective is finding out what's happening on the ground in Cambridge, as well as our YWCAs across the country. And she identifies as an intersectional feminist and believes resistance and collective action are the ways to dismantle the current white supremacist patriarchy. So thank you for joining us, Roz. Finally, we have Simran Dhunna, who is a Toronto-based labor and climate justice organizer with the Fight for 15 and Fairness. She has worked with Climate Justice Peel, as well as CareMongering Peel, which is a mutual aid network. And she also, something common between us is we both have engaged in the public health world. She's currently an epidemiology student at the University of Toronto. I think what I've really appreciated about Simran has been her way of taking messages, political action, and making that accessible for diverse communities. And what's also fantastic about Simran, if you don't know, she does a lot of work with the Canadian Centre for Policy Alternatives. So recently she's penned a couple of different posts on how this crisis has impacted racialized workers in particular. So tomorrow, when we send out some of the follow-up, I'll be sure to link to some of that great work that she's been doing there. Awesome. So that gives you a sense of who is on this call with us today. So I'm going to get started and dive right into the conversation. And so the order I've just gone into, which has been Jessica, Karen, Roz, and Simran, that's going to be the order of the first question. Great. So let me just see if there's any questions here. Nope. Okay. So I'm going to get started on the first question. All right. So the first question is a bit more about our individual panelists, about what brought them to this point, and also understanding what is it that your organization is doing during this moment to respond to this crisis for your community, and other things that you might be seeing on the ground. So each of you has a different perspective, and so that's what we want to hear. So I'll turn it over now to Jessica to get us started. Go ahead, Jessica.
You did.
Oh,
there we go. Thank you. Hello, everyone. Nice to sort of meet you. I always struggle with the question, you know, what kind of brings me here. I think that I've always been a feminist from a young age, but I didn't, you know, I didn't really necessarily have the language or terminology to sort of say that. And so as a result, I've sort of found myself in the movement as an activist, promoting women's rights, gender equity. That's my bottom line. So hence why I kind of I started my work with the Women Abuse Council of Toronto. And we're kind of situated in an interesting position because Women Act doesn't deliver frontline service to clients. In fact, we are I like to refer to us as an intermediary. So we like to bridge the interest between government, funders, organizations, and then those who are frontline. So we work almost exclusively with shelters, but we have been expanding out into corporate partners and other sort of non-traditional gender-based organizations, and sort of getting them to join in the gender movement. So to that end, Women Act hasn't actually, based on where we sit, hasn't actually been able to see any on the ground updates on COVID. And what our response to that was, we put out a survey within the sector to sort of understand what's happening on the ground and what do service providers, i.e. shelters, need to be able to get through COVID. That survey went out at the beginning of April and lasted 2 weeks, and then we were able to establish a report based on those findings, which I'll get into at a later question. But some of the things that I have to say that came out of that survey to me were a little bit shocking, because, you know, you hear things on the news that this is what some shelters are looking for, this is what the issues are, but then our sector survey report, which predominantly focused on the needs of what shelters needed in Toronto, it ended up being not completely different, but some of the key needs were a lot more different than what at least I was anticipating. So it's quite interesting to see that sort of shift, as well as, you know, I'm happy that Women Act sort of stepped up to the plate to say, you know, like, let's put out a survey. Let's actually ask frontline services what they need and want during this pandemic, because I know previously we've seen a lot of sort of top-down approach to policy and response. So this is our way of going about doing a more grassroots way to address the needs of frontline service.
That's great. Thank you so much, Jessica. I'm gonna turn it over to our colleague, Karen, to share her perspectives from the work that she does. So I'm gonna just unmute you, Karen, and go ahead.
Hi, everyone. Thanks, Anjum. Thanks for having me here tonight. I guess, well, I'll just start by saying, so I am based in Ottawa, and I am the daughter of a Latin American family that fled political violence in order to make it eventually to Canada. And as a result, I think of that, I've spent the better part of the last 20 years doing being active in anti-poverty, migrant justice, and workers' rights work. And so through that road, I've ended up where I am now, which right now I am working with the Migrant Workers Alliance for Change as the campaigns coordinator. And Migrant Workers Alliance for Change is a coalition based in Ontario of over 20 groups that work with, are made up of, and serve migrant and undocumented people. And then we are one of over 40 organizations that came together just over a year ago to form the Migrant Rights Network, which is Canada's largest migrant justice coalition. And so this coalition is made up of a number of organizations that work, that are made up of migrant and undocumented members, and that work on the ground alongside and supporting migrant and undocumented workers. So that means that what we're talking about in that sense is we're talking about, when I say migrant and undocumented workers, we're talking about people who are in Canada on work permits, on study visas, people who work, have come in through the live-in caregiver programs, people who come in through the temporary foreign worker streams and the low-wage streams, who work in the agricultural and food sectors as seasonal farm workers, in other food production and processing. And we are also talking about workers who have no status and do not have valid social insurance numbers and are working as undocumented workers. And these are folks who are working in all of the essential sectors on which we're relying during the COVID crisis. So these are workers who are in cleaning, who are in care work, whether in private homes or in long-term care homes, in hospital settings. These are workers in food production and processing and retail. These are workers who work in logistics, in delivery, in warehousing, and in construction. So these are all the essential sectors which we have come to again and again saying and hearing from our politicians that these are sort of the essential sectors and the workers on which our communities are depending right now for their livelihoods and for their safety and for their health. And what's been happening over the course of this crisis is that we've seen that either these workers, migrant and undocumented workers, are either facing an intensification of work in the context of few rights, low wages, no respect for their health and safety, or have lost work and have little or no income to COVID-19 supports, income support or access to healthcare and so on. So what we're seeing is that this crisis has really been made worse by how the immigration system works and breeds inequality and exploitation by design. And so this crisis has just sharpened the lived crisis experience of the folks that we work with and support, who are living in extreme crisis now, right? So these are crises of housing, of income security, of food security, of health, and of safety and of dignity for not just migrant and undocumented workers, but for entire families, families that these workers are supporting here and families that these workers are supporting abroad. So the response of the folks who are in our membership has been, on the one hand, immediate crisis response. So our members have been mobilizing, often with very little or no resources, for immediate response: food, healthcare, housing for folks who have lost all of those things in the context of COVID-19. And you know, these groups are often the only folks that are able to provide supports to the communities that I'm talking about. And then we've been taking that information, that access to information and those relationships of trust that we have with migrant communities and using that to drive and to inform the policy change that we've been pushing for. So in the context of COVID-19, we've been pushing for a crisis response that leaves nobody behind, and especially around questions of immigration status. But we have been also pushing for policy change on an ongoing, like before COVID hit, but now, especially now and going forward, for major policy change and systems change for, like I said, those larger systems that are responsible for the injustices that we're seeing laid so phenomenally bare right now.
Thank you, Karen. And I think both yourself as well as Jessica have really talked about how all of these crises are intersecting, but also how there's been this manufacturing of precarity. And that's really left more communities that were already vulnerable even more so. So thank you both for the perspectives you're sharing. Next, I'm going to ask Rosalind to share a bit about her experience being the Director of Marketing Communications at YWCA Cambridge and the work they're doing there, but also some of the other things that she's been seeing in the YWCA movement. Over to you, Roz.
Thank you, Anjum. Thanks for having me. I want to start by saying I live with two other people who are both watching TV, so I'm so sorry if you hear that. Yeah, so I guess I'd like to start by socially locating myself. I am a white Canadian-born cis woman, middle class and queer. I have had access to post-secondary education, as Anjum mentioned. And I started with YWCA just over a year ago. I've been with YWCA Cambridge for a year and a bit. Before that, I was working for a public sector union. And before that, I was represented by that union, teaching in post-secondary education. So in terms of what's happening, I guess, at my YWCA, but also just broadly speaking across all YWCAs, It was when everything shut down. It was just a massive, massive pivot that was required. So those of you who don't know, YWCAs across Canada, we provide shelters, we provide childcare, we provide programming for a lot of vulnerable folks, including pre-employment programs for women, programs for children, teaching healthy relationships, and body image, body positivity, things like that. Those things that are more of the sort of that contribute sort of to like holistic wellness of the young people in our communities. And so what's been happening, I guess, among the YWCAs is just massive pivoting. So childcare centers shut down. So for my YWCA, that meant a 50% loss in revenue. That also meant instant layoffs, which has been happening across the board, across the country. We know that a vast majority of childcare centers have already had massive layoffs. We also know that a vast majority of childcare workers are women, and of those women, a number of them are racialized women, Black and Indigenous women. So it's pretty intense being in this, but the way that YWCAs have been responding has been really fantastic. I know there's been a bunch, YWCA KW, YWCA Guelph, they have, I have to look at my notes for this because I can't remember what all 32 member associations are doing, but sorry, YW Halifax and YW Guelph, they're providing safe accommodations for essential workers like healthcare professionals and truck drivers. Vancouver Island has been providing cell phones and internet to low-income women and youth in their housing to ensure that they have access to public health protocol information. YWCA Toronto and YWKW and YW Sudbury have moved women into hotels to ensure physical distancing requirements. And what this also has meant is a massive, massive expenditure for all of these YWCAs. And then on compounding that is the fact that workers can only be deployed to one physical location. So we're having staffing issues across the board. Folks don't really want to subject themselves to these high risk environments if they don't have to. And also it's just a matter of before where staff could be deployed to one physical location, they no longer can be. And so that has proven to be a mega difficulty for the YWCAs that provide shelters. We've seen that in the Northwest Territories, YWCA, they have been working with local authorities to around domestic violence. They've seen a 50% increase in calls around domestic violence. So they've been working to have it so that it's the perpetrator of violence that leaves the home. It's not the women and children. So all of these things are changing. But what we're seeing here in YWCA Cambridge, we don't provide shelter or housing. Our biggest thing is programming and childcare. And so what we're seeing with our service users and our participants is mass anxiety. And I'll issue a trigger warning, this is a bit upsetting, but we do know of one participant who we already knew had mental health concerns, and the isolation just triggered her, compounded her complications, and she was hospitalized for almost taking her life. We have women who are unemployed. They just finished pre-employment programming. They were ready to get into the workforce. They were ready to have a schedule, and now they can't, and they have their children at home. Some of them don't have computers. They don't have access to internet. So they're wondering how they're supposed to help their children learn from home. How are they going to go to the grocery store if they're a single parent? They don't want to they don't want to bring their children with them. They certainly don't want to leave them alone. A lot of things, I guess, to that effect. We've also been hearing a lot about women who are on OW and ODSP cannot get in touch with their workers to find out what they have access to. And some of them who have applied for supports, they still have not seen those supports. So what my YWCA has been doing, and I'm very positive a lot have been doing, is we've been putting calls out to collect food and activities and things for families, and doing porch drop-offs just to do something. And with the layoffs that we had experienced early April, we were able to call back all the childcare staff because of the 75% top up from the government, which means we still will be losing that 25%. not losing, but spending it, and we're not making it in childcare fees. And so that is a little precarious. We also had a social enterprise that was, those of you in the nonprofit world know that we're constantly being told to diversify our funding. And so we did. We have a social enterprise, and now it's not open. So we have hundreds of thousands of dollars of stock just lying there. So I guess that's sort of the gist. We're all essentially just facing financial devastation, to be honest with you, which means that all these services that we provide across the country for predominantly cis and trans women and girls and non-binary and two-spirit individuals is being put at risk.
Thank you, Roz. And I think thank you so much for sharing the perspective of YWCA Cambridge, but also the movement. I think there's such a diversity in terms of what we do as a YWCA movement, but I think we also are seeing, in our first webinar, we talked a lot about the gendered impacts of COVID-19, but you're really highlighting what that looks like on the ground and the challenges that are compounded by this crisis. So thanks for giving us that large scale overview, as well as kind of delving deep into what's happening on the ground. I'm going to turn it over to our colleague Simran, who's going to highlight some of the work that she's been doing, as well as some of the mutual aid work that she's been doing as well. So over to you, Simran.
Thanks, Anjum, and thanks for having me. Hi, everyone. My name is Simran. So with the first question, how I got started in this work, I actually started organizing just over 2 years ago with the 15 in Fairness campaign and with the Workers' Action Center. So my roots are really with labor organizing, and that's really what galvanized and radicalized me. And that's also through the organization through which I met Karen. So it's really nice to see you through Zoom here. And a lot of that labor organizing I was doing was through the Decent Work and Health Network on campus and also in Brampton. So really embedded in a lot of different communities with different types of needs. And then over the last year, I've also gotten into climate justice organizing through Climate Justice Toronto and Climate Justice Peel. But what I want to talk about more specifically with regards to COVID-19 is CareMongering Peel, which is one of the Facebook groups that you may have seen. There's a really, really big Toronto one that started just immediately after folks started self-isolating over a month ago. And so similarly, myself and a couple of other people, community members in Peel, people who had pre-existing relationships with each other, started a caremongering group on Facebook in order to support vulnerable folks in the Peel region who are often neglected. So the context of Peel is that there are actually a lot of NGOs who are providing support through the form of food banks or other forms of support. There are just a few shelters. But other than that, the Peel region is often not seen as very political. There's a lot of NGOs, but in terms of the types of the movement ecosystem that we see in Toronto isn't as apparent, but it is definitely happening here, and it's definitely being galvanized through this crisis. But also there's a lot of other contexts that are missed in the media. So, for instance, most of you might be aware that the Peel region is predominantly racialized. I think it's around 65 or 63% of Peel is racialized, and particularly in Brampton, it's the overwhelming majority. And a lot of workers are working in warehouses, they're working at the airport, they're working as PSWs or in precarious forms of employment. And they're also traveling a lot through the broader GTA region. And we just heard, I think it was yesterday or today, the second personal support worker passed away from COVID-19, and she was a Black woman from the Peel region. And the first woman to die from COVID-19 as a PSW was actually a Filipino woman in Scarborough. So it just goes to show, like, the suburbs are very much an area where there's a lot of precarity. There's a lot of folks in dire circumstances, whether in their workplace or in their home or in their community or on the streets. And a lot of that is often invisibilized. And so with CareMongering Peel, we started off with a Facebook group, but we now have a couple of different tools where we're trying to meet people's needs beyond sort of NGOs. And part of that is through the neighborhood pod system, which some of you may have heard of through mutual aid networks. And this is a concept, the pod system, that came from disability justice organizers, Mia Mingus in the United States, where particularly for neighborhoods, you have a sheet of paper that says, hi, my name is Simran. I'm in your neighborhood if you need support with, acquiring medicine, or you need someone to drop off groceries for you, or you need someone to talk to. You can just post that note on their doorstep or somewhere near their house, and it just lets people know in your immediate vicinity, in your immediate neighborhood, that you have people looking after you. And the purpose of this is that you can then reach out directly to people who are, for instance, not on social media. You can get those cards or that material translated, and it's a way to reach people, particularly in Peel, who have various multilingual needs, for instance, and you can connect through WhatsApp, and that's what we've been trying to do as well. And in addition to that, we also have a needs and request form, so we're trying to meet the needs of people who do feel comfortable reaching out. And so, for instance, we've gotten folks who are working at warehouses and who are immunocompromised but really have no choice but to go to work, or international students who don't know what supports they're eligible for, and the vast majority aren't actually eligible for government supports, particularly if they're undocumented, as Karen mentioned. And in addition to that, we're also working on public education material. We've seen an increased presence of police in our neighborhoods, and increased policing that disproportionately affects homeless, Black, Indigenous, and other marginalized groups in the community. And so we're trying to also share with people what are the implications of this crisis, who's left out and who is further criminalized. And so these are some projects, some initiatives that we have and that we're trialing, and it's really, really interesting. But one thing that we're also reminding ourselves as our group grows and as organizers is that mutual aid is not charity, it's solidarity. It is inherently political, it is radical. It comes from a tradition of labor organizing as well as Black liberatory organizing, the Black Panthers, who were socialists, right? And who were anti-colonial. And so these are values that we want to bring into this space. And many of you may have noticed that mutual aid is depoliticized. We're just like friendly Canadians, but that's absolutely not it. We want to be coming into this work through an unabashedly solidarity, anti-capitalist perspective. And so that's happening right now. And I'm happy to also answer questions about that at the end.
Thank you, Simran. And I really appreciate you going into some of the practicalities of organizing and the inherent political nature, and really stressing and emphasizing that point, because I think this moment has shown us that we have to be political, because that's how we get to have the choices that need to happen for the betterment of our society possible. So thank you so much for sharing. I'm going to move us to the next round of questions, because now we've gotten a sense of our organizers and advocates on the line and what brought them to this work and what they've seen on the ground. Now we want to talk a bit more about the systems change that Karen highlighted earlier, and how we want to take what we're seeing on the ground to inform the types of policies we need different orders of government to push forward. And also, what have been the gaps? We've seen a lot happen over the last 45 days or so, which has been great, but there's a lot of communities that have been left behind. So for this next round, I'm gonna actually go in the order of Karen, Roz, Simran, and then Jessica. So we're gonna kind of change up the order each time, so people get to kind of start first. Different people get to start first. So I'm gonna ask Karen, so you're unmuted, so feel free to share your perspective on this.
Thanks. So I was thinking about this question and how to sort of sum it up, because there's been, I think, as everybody jokes, like, what is time anymore under COVID, and everything seems like It happened a year ago when it was really only yesterday. And part of that is because we've been seeing responses kind of like frantically at all levels of government, people kind of scrambling to keep up with the evolving nature of the crisis and to issue responses at a policy level. And so I think what we've seen overall is that things are, the way I would summarize it is that the responses that we've seen from various levels of government are both unsurprising and inadequate and also incredible. And I'm going to explain what I mean by that. So on the one hand, like I was saying, we've seen a lot of really sort of piecemeal catching up with the reality of the crisis. A lot of really sluggish responses from all levels of government that are not taking the lead from those communities that are the most impacted by the crisis, which then, but are responding to some of the interests that normally drive policy change. And so we've seen things like, I'll take as an example, the Canadian Emergency Response Benefit, CERB, right, changed daily in the first few days that it was announced, and has been changing weekly, and yet still manages to not meet the needs of many of the workers that are facing the most hardship. And partly that's because the people who are making those decisions about those policy responses are very out of tune with the realities of the economy and the workforce and the labor market right now, and the realities of the rising predominance of low wage and precarious work, and the ways that it is that workforce is highly racialized and highly gendered. And then at the same time, you know, among the first announcements that we saw when the crisis first hit was sort of more of the usual. So bailouts for big businesses first, fastest, and often. So in that way, it's been unsurprising and inadequate. And we see that on the ground in the work that our members are doing, because we know that we are, like I was saying before, I mean, the crisis is enormous for migrant and undocumented folks right now. We are getting phone calls on the daily about people who are having unassisted births at home and haven't had medical attention yet, of people like farm workers who are locked on farms without access to food, care workers that are being locked in basements and not allowed to leave, right? Because they're considered by their employers to be vectors of disease. So these things keep happening, and the policy responses are not adequate enough to respond to those needs, because those have never been the communities and the classes of workers that have been the priority for driving policy. And at the same time, some of the responses that we've seen at a policy level have been actually really incredible. So suddenly we can have free or nearly free transit. Suddenly we can put moratoriums on evictions and deportations. Suddenly we can have shuttered automotive plants that are making essential protective equipment. Suddenly we can recognize the sort of life-saving, life-generating work on which our communities depend that has always been there and that we never see. So in a way, we suddenly seem to be possible. All of the things that we've been told through like over 30 years of austerity are impossible, right? We've had governments across the country at the local level, you know, like put bans on the expansion of Airbnbs, for example, and vacation rentals, and reappropriating hotels for homeless shelters. And so the responses continue to be inadequate, but actually they can move in a direction that has been very surprising. And it really shows us what is actually possible when we're moved to act. And so what we've been fighting for since the beginning in the response is, like I said, a response to the COVID-19 crisis that leaves nobody behind, a migrant justice response to the COVID-19 crisis. And so what we have been calling for, we launched a petition at the very beginning of the crisis that shockingly, all these weeks later, has kind of stood the test of time, unlike almost anything. That had sort of some core demands, right? And so the demands were healthcare for all, regardless of immigration status. And that was partly because in the immediate term, in terms of access to COVID testing, access to healthcare for people who were showing symptoms and who were sick, it was very much stratified by immigration status, poverty, you know, these sorts of factors like language barriers, things like this that were preventing people from being able to access the testing that they needed, and then therefore the care that they needed. But more broadly, people continue to have broader health needs that are exacerbated in a time of crisis, when there is less income, when there is less food security, when there's more anxiety, and a healthcare system that isn't actually fully public in this province or in any province, and that doesn't actually fully serve all people. And then the second set of demands was around worker protections and rights. And so obviously our focus and the fact that our base is primarily of migrant and undocumented workers, these are really key issues, right? Of folks who, because of their immigration status, are unable to, do not have the same rights as other workers. And even if they do, are unable to assert them because they risk their status at every turn. And so demanding full worker protections and full rights for all, regardless of immigration status, and which includes decent wages, paid sick leave, and labor mobility, and full protections for all workers that are in precarious and low paid work. Like Simran had mentioned, we have lots of workers who are afraid to go to work, who are working in dangerous conditions, cleaners being sent to work without the proper protective equipment, who simply do not have the option to assert their right to refuse unsafe work or their workplace rights because there's too much at stake. And so similarly, our other demand has been for full community supports, and that has been for a massive public investment in those community support systems that are already so stretched to the brink. So that means access to safe and affordable housing, which includes rent freezes and moratoriums on evictions, massive expansion and investment in the shelter system across the board, access to universal health care, access to quality food and the opening up of free food systems and food banks and food delivery and distribution, massive improvements in social assistance for all, again, without all those barriers that normally keep people off of assistance or keep people living in immense poverty while on social assistance. And then finally, an end to detentions and deportations. So in the beginning of the COVID crisis, the government announced a temporary moratorium on deportations. In some cases, deportations are still happening in cases of quote unquote extreme criminality, but we know that detentions are still proceeding. We also know that the government machinery has virtually come to a standstill. And that means that people are getting much reduced access to their refugee hearings. People's work permits and study permits are expiring, leaving them without the ability to work or access social supports. And that's putting a lot of people in an even worse crisis than they were in before by no fault of their own and by fault of the government response to this crisis, including the border closures, right? Which initially when they first happened, shut out many migrant workers from being able to come here and start the work on which they depend, the incomes on which their families and communities depend here, shut out international students, postgraduate work permit holders, shut out refugees who were crossing the land border from the United States. So calling for an end to detentions and deportations, full stop. And tied with that, and essentially overarching, a call for status for all now and going forward, because it is the way that the immigration system creates tiers of people, or of residents living in this country who have differential access to rights and protections, that produces the kinds of systemic inequalities on which the economy relies, actually, and on which many people make a lot of money, that in a time of crisis like this, is really laid bare and is driving people to the brink, really, of their very own survival. And so we're sort of calling for those immediate kind of things in the here and now, but that are linked into broader sort of longer term changes that I can go into a little bit later. But definitely the status question is that a lot of us have been talking about the need for status for all now for a very, very long time. And we find ourselves in a moment now where politically that's suddenly becoming an option for a lot of people, and it's becoming a lot more evident for a lot of people that the immigration system puts people in dangerous, life-threatening situations, and the immigration system puts people on which all of our communities depend and to thrive and to be healthy in situations that are untenable and that are unjust. And so our vision of a COVID response that is just and that is based on the principles of migrant justice is really that these principles and these demands that migrant and undocumented folks are fighting for are actually about a society and a vision of places where we can live that are better for all of us.
Thank you, Karen. And I really appreciate that piece around leaving no one behind, and also around that migrant lens and how we are all benefiting from the hardships and inequities that that migrant workers and undocumented folks and non-status folks are experiencing. So on that note around leaving no one behind, I'm going to ask Roz to go next and share from her perspective who is being left behind and what can we do better when it comes to these pandemic policies. Over to you, Roz.
Thanks, Anjum. That was fantastic, Karen. Thank you. My response will be centered on the nonprofit sector, on YWCA, because that's what I'm here for, like as the speaker. So I would say, I would echo a lot of what Karen said in that when Karen started speaking, in that the response, the government's responses at all levels has been extremely piecemeal. It's very obvious that they had full intentions of giving the bare minimum in their initial responses, and credit where credit's due. There have been some great advancements in the supports that we've been seeing come out. However, those supports have come out in response to collective action. So we did not get funding bookmarked for VAW shelters until the community fought for it. We didn't get hazard pay until the community fought for it. And so it's great that, yes, we're seeing that more and more folks are being represented in who's getting the support. However, yes, still there's so many people who are being left out and behind. How I do see, though, that there is sort of room for hope in that we have been able, and again, Karen, you had mentioned this, that like these issues are being brought to the fore right now, and this is the time to galvanize around these age-old issues of systemic discrimination and oppression, and now it seems that the government is finally listening, because everyone's just galvanizing now, and I think this could be a really exciting time. In terms of in my sector, we have been seeing some supports come our way. I do want to say the nonprofit sector in Ontario it's not insignificant. We bring $50 billion to the Ontario GDP. Nationally, we bring $170 billion to the GDP. We are 80% women, and the vast majority of, or a large percentage of those women, as I've mentioned before, are women of color, Black and Indigenous. So we are facing total devastation that I've mentioned earlier. We haven't seen the supports come from the government that is telling us that we will survive this. And it's not just organizations like YWCA, it's even like arts and community sports associations, which, given what we've just been discussing, I guess might seem fairly insignificant, but I think that all of these things certainly contribute to the social fabric and social well-being. And so what we're fighting for is that the contributions of the nonprofit sector are recognized in these supports, because it's 2.4 million Canadians that are employed in the nonprofit sector. It's not small. And I guess also what also this is going to be bringing up is the government's total disregard for childcare. Yes, the government has been rolling out childcare for essential workers, but we're a childcare provider, and we still don't know how it's being rolled out, what measures are being taken to protect the children in the care and also the care workers. But this is also raising a really interesting point where the folks who are getting access to childcare right now are the now deemed essential workers, who, as we've discussed, are grocery store workers, are service workers who are predominantly women and low wage. So they actually, ironically, didn't even have access to childcare probably before, to generalize, I suppose. So what this is really highlighting is this need for affordable universal childcare. Everybody now is finally seeing what it's like to not have childcare. If you're at home working and you have children at home and you are trying to do your job from home, and you're also trying to raise your kids and help them learn in school, I think everybody's starting to understand how critical it is that absolutely everybody has access to childcare. And I think that has a ripple effect. So give us childcare, give more women access to full-time work, give women more access to economic, what's the word? Autonomy. And then it all bleeds into each other. So give women more access to economic autonomy, which then gives women more access to, if they are in unsafe conditions, they can afford to escape. So all of these things sort of really bleed into each other. And this is one very minuscule sliver of a silver lining that all these issues are being brought to the fore. I'll leave it there.
So what I've started to observe is how it's almost a prerequisite for every other part of society, every single sector. So how do we ensure that when this crisis is over, that is not forgotten, how it's fundamental to our recovery? So thank you so much for sharing. I'm now going to pass it over to Simran to share her perspectives on this question and what pandemic policies are good, what's bad, and what we need to do moving forward. Over to you.
Thanks, Anjum. It's a really big question, so I'm going to attempt to summarize it and also not repeat things. So I think the first thing that the government has been doing, and Karen alluded to this, just like these daily, really pretty torturous press conferences where they're like, oh, here's another crumb, here's another crumb. And it's like, we can't be relying on means testing and on these like technocratic ways to provide people what they need to survive while other people are left behind, whether it's migrant students or people who are, on ODSP or, on social assistance, and their benefits don't match the $2,000 that people get through CURB. And so I think we really need to push for all kinds of income supports that are absolutely universal, regardless of status, regardless of where you are or what you're, where you're working. And it's important to remember that not only is that costly for the government, but it has material consequences for people. It results in a lot of suffering and death. But beyond that, on the part of the government, it's actually pretty strategic in further dividing us. I've already noticed, for instance, on like Punjabi television, you have people calling in and they're like, well, these international students, some of them have access to the $2,000 CURB, but these are domestic students, like I only get a fraction of that amount. And it's already fomenting resentment in people because they're like, well, this person gets it and they're not considered Canadian, but why don't I, right? And so it's something really nefarious, and we have to really name that and call for universal support, universal public services. And that's also been a demand of the Migrant Rights Network as well for a really long time. And notably, like, there's a hypocrisy of being like, well, you have to fit all these eligibility criteria if you want to be able to survive during a global pandemic. But hey, if you're a corporation, we don't care how much you're, how big you are, how profitable you are, we're going to give you 75% wage subsidy. So that clearly that universality doesn't apply to the corporate class. Secondly, there's been a greater tendency to turn towards the private sector. And so we've seen that, for instance, through, the federal government making closed-door deals with Amazon to store and manage COVID-19 testing kits or N95 masks, when we actually have publicly owned Public Health Agency of Canada warehouses around the country those warehouses just have been poorly managed, and they don't have enough workers managing those warehouses. But instead the government is saying, we're not going to consult anyone, but we're going to rely on this notorious employer. Or, for instance, in Ontario, we've all heard the horror stories in the long-term care sector, and that's been a result of not only the last 2 years, but decades of austerity and funding cuts. And so we really have to, I think, push for public ownership over these things that we're relying on now, but we are going to be dealing with more pandemics, with more climate crises, and we have to ensure that workers and communities have control over how things are produced, what the working conditions are, and how people are affected day to day through those supply chains. Thirdly, as I mentioned earlier, there's been a turn towards severe criminalization and policing, but also an invisibilization of struggles of incarcerated people. There have been a lot of car caravan protests. There have been hunger strikes at the Laval Migrant Detention Center, and that's gotten little to no mainstream media attention. And in fact, in Peel and Brampton, there was an outbreak at the prison here, but they simply just moved everyone to Toronto South Detention Center, which is notorious for awful conditions that are against human rights. And so that's a struggle that's really been invisibilized, and it's something we really need to sort of include. Like, there are people being left behind and to die in these death camps. And lastly, there's been, again, like, we're seeing a narrative around businesses, we need to give them wage subsidies, but there are certain businesses, certain corporations that have a monopoly, whether it's Loblaws over the grocery store, retail trade, or Cargill, and like a handful of companies who make a profit from the bulk of meat processing in the country, and they're actually turning a profit during this crisis. Yet, for instance, they are being given a break, being given a pass to pay taxes, or we're seeing the government show a reluctance to actually make people who are profiting from this crisis to actually pay for the crisis. And instead, what we're seeing is wage subsidies or like rental relief that isn't actually going directly to workers or renters, but is actually going to people who have disproportionate power over others. And we're just relying on their goodwill to hand off that money. And so there's, again, like, there's a narrative that their trickle-down economics works. And I think we really have to push for policies where people are actually have in their hands what they need to access care, and actually decommodifying survival and care. And as Karen said, we're actually seeing how all these things that were possible, that seemed impossible before, are now possible. So we're actually seeing a raising of expectations, and that's something we have to continue to pull from as we build our movements.
Thank you, Simran, so much in that and such richness. I think one of the things that I was hearing is how the social safety net is inadequate and how we need to push the envelope there, but also how we need to couple this with increases and expansions in public service. And thank you for highlighting some of the things I've been very concerned with, which is around how public health measures are being used as a tool for criminalization of certain bodies. I think one of the things that YWCA Canada is working on, thinking about some of the economics pieces you talked about, is how do we actually reimagine a society from a feminist lens? We're hearing a lot about now an economic recovery plan that is starting to be formulated, but where do communities that have been most impacted by this crisis, where are they in that? So we're starting to think about, from a YWCA perspective, what is a feminist economic recovery plan look like for Canada, and something that we're working towards in the next couple of weeks and releasing. So now I'll pass it over to Jessica to have the final say on this round around pandemic policies and what she's seeing as beneficial and what she's seeing as problematic or what needs to be improved upon. And then we'll wrap up this round. We had a lot of rich conversation. So what I'm just going to say is the next round, we're going to keep it very brief, a minute apiece, because then we can get some questions and then wrap up as well. So just to kind of give everyone a sense of what's next. So pass it over to you, Jessica. Final word.
Thanks, Anjum. And I have to say, I'll keep it brief because all the speakers ahead of me have said some really truthful things, and quite frankly are some of the things that we've been seeing here at Women Act. From the violence against women perspective, we saw quite early on in the pandemic that the federal government announced $40 million to address gender-based violence, which was great, but only 26 million of that money would go directly to shelters, and it would only be 575 shelters across the entire country. But we know that there are many shelters who are not recognized in that 575 as well. There are other organizations who are doing gender-based violence work, such as the Assault on Women's Hotline here in Ontario, who would not qualify for that funding because they're technically not a shelter, but they're doing extremely important gender-based violence work during this pandemic. And you know, the announcement is great, but I think that I think it just goes to show that there's still gaps and there's still needs across the country to address gender-based violence. And you know, I feel like often our governments are pushing shelters as options for women who are fleeing gender-based violence, but really we need to be looking at a wider scope of things. Not all women want to go to shelter. 60% of women say that they don't want to go to a shelter when they're fleeing violence. The root of that problem is the inaccess to housing, which as I want to say, want to say, Simran, you were talking about access and how things have sort of been exaggerated. I think that through CERB, we've sort of realized that as it's supposed to be, a subsidy to support with your expenses during this, that we see that a $2,000 a month stipend isn't enough to even cover people's rent, and people are still choosing between rent and food. And so it again brings up this problem that that not enough people are able to access affordable housing. And that's often been a very big struggle in the violence against women sector, is access to housing and accommodation. And so I think that COVID has definitely exaggerated that. And while the announcement was good, I think that there needs to be more, and an expansion of who we think is addressing gender-based violence, because it's not just shelters. Additionally, I'm not sure if folks know, but OHIP, so Ontario, actually expanded their those who can access healthcare in the province. So you don't actually have to have an OHIP card anymore to be able to go in to access medical care, which is great. But how many organizations actually have this information? There's not a lot, and that's the second problem that I kind of wanted to get into. There's these great, like, mind-blowingly boring, but with little tidbits of information, press conferences that happen, daily by our federal government, which is great. But we're not actually hearing the policy recommendations, and we're not hearing the information that will actually make an impact to people's lives during COVID. And that's what we need. That's the information that we need to hear. That's the information that we need to see. And we can't tell people, oh, go online to access that information, because not everybody has internet, and not everybody has computers, and not everybody can afford, especially during these times, these challenging times, to afford, internet or data for their phone to be able to access those things. So I think that some of those policies or people who can access services has been classist, and it's only those who can actually afford to access services are able to access services, which is unfortunate. I'm gonna not try to repeat anything that has been said before, but I know that this has been a problem impacting the healthcare system, but particularly in shelters, it's been the lack of access to PPE, so personal protective equipment, masks, gloves, sanitation, and it can get quite scary for a lot of workers, but also those who are living in shelters around. Their risk to spreading the virus while they're at a shelter. So, our government has done a little bit to sort of address those concerns, and we've seen the lack of access to PPE sort of evolve into an international problem. But it's definitely a big barrier, which I don't think that I don't think our government has responded. Any level of government, quite frankly, has responded in a good way. I definitely agree that I think that there needs to be a prioritization of those who are working in the healthcare sector. But what about those who are not in healthcare but are still extremely at risk, such as those in shelters? Including the testing of those who are from vulnerable populations. So women who are fleeing violence, the homeless population, seniors and such. We haven't actually seen any sort of prioritization of those COVID testing kits for those who are more vulnerable to the virus, which is it's an unfortunate thing that I think needs to be addressed quite quickly. And lastly, I think that the safety and well-being of what we deemed essential workers, so health workers, obviously, but people who I think before the pandemic we didn't necessarily see as essential, such as people who work in childcare centers, grocery store clerks, people who work in the gender-based violence sector, people who are actually who are working in NGOs and delivering services, food banks included. We haven't been prioritizing their health and well-being from before. we're not ensuring that, you know, they have access to adequate healthcare themselves to ensure that their health and their safety, including their mental health, is addressed while they're trying to support people going through a pandemic. So I think that that's also highlighted an extremely important change to policy, particularly labor policy, that they're, you know, who we considered essential and who really needs access to social supports has been traditionally excluded. And I think COVID has sort of exaggerated the fact that, you know, these groups of people are who are vulnerable, are who are essential, and are who will actually be supporting our communities when things like this happen. So I'd like to see definitely some changes to policy. And I think, Anjum, you said it, COVID has opened a window of opportunity. And I think people are experiencing it firsthand, but I'm just hoping and praying and crossing my fingers that, you know, post-COVID and as we start to rebuild the economy, we don't forget the lessons learned while, you know, we were experiencing COVID, and we don't get COVID amnesia to some of our policy requests and some of the advocacy work.
I think that was a wonderful way to close out this round. And I just want to really highlight some of the things that came out from your commentary. One, I think in particular, is the classist nature of what some of these policies, the implications of some of these policies. I think in Canada, we don't talk about class. We don't really delve deep into that. So I think really thank you for highlighting that piece. I think another piece I appreciated was around plain language. This is very complex announcements and complex measures, and what can be done to better enable communities and just people who even do this work for this policy work for a living. They're finding it difficult, right? So I think this really shows like this fast and quick responses has to also take into account, can people actually understand and actually act on that knowledge? That's a key piece. And finally, this is something we've been talking a lot at YWCA around housing. I think what I'd like to see, just to give a bit of my own kind of take on it, we're seeing the things that really matter in this crisis are the social determinants of health, one of which is housing. So I'd like to see, from my perspective, how we can use the social determinants of health as a roadmap for future investments down the line. So given we are at 8:05, 8:06, what I'm gonna do with the next round is it's gonna be very rapid fire, or rapid response. It's gonna be about a minute or so per person. And when I was looking through some of the questions that people have shared, many of them were on the note of hope around what to do next. How do we do better? So in that spirit, I think this next round and the questions already we've seen in the chat really align. So what I'm gonna ask folks to do, sorry, I'm just gonna advance to the next slide, great. So in a way that encapsulates these questions in a minute or so, what does this moment represent to you and your community? And what is one thing we can't forget? If you want to give us something around hope, feel free, but I think many of you have talked about that in some shape or form already in your answers. But really, what does this moment mean for your community, and what is one immediate next step that we should be taking? So for this round, I'm going to ask, I think, Roz to start us off, and it's going to go Roz, Simran, Jessica, and Karen will have the last word. So very rapid response, 1 minute or so. Over to you, Roz.
Thank you. I'll be really quick. I want to touch on one thing Jessica said that reminded me of something I forgot to say. I'll take 10 seconds. Jessica, you mentioned that not all VOW work is shelters, and that is so accurate for a lot of the programming that YWCA does, and funding often forgets that. So it's prevention work as well. It's teaching people when they're young. So what this moment represents to me, it is that there's hope. Everyone here has said that we are all galvanizing around it, and what do we need to do to prevent COVID amnesia from happening? And I think, well, we're all at home, so I still remember my university professor calling it armchair activism, people who used social media, but he was a boomer. So I think what we really need to be doing is finding the organizations to follow migrant workers action, follow all of these organizations, follow YWCA. YWCA Canada has been doing amazing feminist analysis of what we need to see as and why we need an intersectional feminist lens applied to policy. So sign all of the petitions because they're clearly having an impact. And so I really want to hold on to hope. I want to see Airbnb gone. I want to see ODSP and OW rates raised for good, and I want to see the minimum wage stay where it is at with the hazard pay. And I want universal childcare. And I think we can do it.
I think so too. Thank you so much. A great call to action. Next, over to Simran.
Sorry, I was muted. My answer to the first question is so obvious. What does this moment represent to me and my community? It's an opportunity to organize. Of course, my caveat is that like this work is really, really tiring. And I know like myself and among other organizers, like there's like obviously an urgency and an anxiety to be like always on. And like now it's very easy to be always on with screens and everything. So just taking time to take care of ourselves and check in. But particularly I think for Peel, where movement infrastructure and like a movement ecosystem is still like in its early stages, I think it's a really important opportunity for coalitional work. You know, like there's a warehouse worker center that was just launched here in Brampton a year ago. What are they doing? Or you know, the 15 in Fairness campaign and the Decent Work and Health Network, their calls for 21 paid sick days. How can we bring that work here in the suburbs where there are a lot of people who could really, that would be life-changing for them. So I think it's an opportunity to really build stronger community connections, and also to bring more people into the fold, to bring young people into the fold, into movement organizing, and really like talk about what organizing is, because it's not, I mean, like certainly social media is a tool, but it's also like, for instance, like the neighborhood pod system. It's a way to actually like, how do we actually be in conversation with each other, with our neighbors, and have tough conversations? And how do we also learn how to be in community with each other? So I'm thinking a lot about, in terms of the question around hope, like what is driving me? It's a lot of disability justice organizers, Black and Indigenous communities, sex worker communities who have been living under crisis since the very beginning, and their mutual aid efforts and their efforts to organize and push back against systems of oppression are a source of hope for me, and a source of like solace, but also like a model for how to organize, and also workers and communities who are pushing back. So there's a lot of workers in the US, but also here, who are striking tomorrow on May Day at Amazon and Whole Foods, and there's workers here as well who are pushing back through their unions, and who are getting you know, for government, for instance, to give pandemic pay to paramedics, and we need to keep expanding that and keep extending solidarity towards these movements and communities. And finally, I would just encourage everyone to figure out what work is being done. Don't replicate work. Don't feel like you have to start from scratch. Support the movement work that's already happening, and just like reach out to someone who's in a movement space or with an organization and be like, what role can I play here? And like just go from there. Small acts and relationship building are really important right now.
Thank you so much. Great. Next, Jessica, and then Karen afterwards.
Thanks, Anjum. I'll be as brief as possible. I think that COVID has definitely highlighted the importance to remember that violence doesn't stop even in a pandemic. Unfortunately, we've seen 3 reported deaths that have been directly related to domestic violence, and even more unfortunately, it's sort of estimated, or it's been suspected that the Nova Scotia shooting that happened, you know, recently, the catalyst for that event was actually a domestic incident, and you know, violence against women. And so I think that, you know, we see that violence against women doesn't stop even in a pandemic, even in a global crisis, and that COVID has, and I hope that COVID has sort of opened folks' eyes to that. And I think it'll be a lot easier moving forward to sort of speak to the importance and prevalence of ending gender-based violence, because, you know, even when things are are extremely uncertain, again, the violence doesn't stop, and we need to be addressing some of those root causes, which are financial abuse, access to childcare, affordable housing. Anjum has mentioned the social determinants of health, and really rebuilding a society that puts people first, not our economy, not our businesses, but people and their outcomes. And when we support people, I reckon that a lot of the violence that we see will be reduced, because women will become empowered both financially and both systematically to be able to flee their own situations.
Great, thank you, Jessica. And over to you, Karen, for the final word, and then we'll wrap up for our session tonight.
Well, I would echo everything that everybody just said around sort of what the COVID-19 crisis is laying bare for us. But I think I'll just take it from a different angle and to say that from the perspective of migrant and undocumented communities, this crisis is definitely laying bare all of those hideous inequalities. That is a crisis and a kind of inequality that migrant and undocumented communities know very well. So it is not new, actually, for the folks who are experiencing the brunt of it. It is getting worse, but it's not new. But what it means is that this is an opportunity, as more and more people are kind of like, I think, getting to realize the extent of the ways that our social supports and our systems are not working for most people. It is an opportunity for people to finally see that reality, and it's an opportunity for those folks who are the most impacted to be able to show what that reality is like, and to take up the leadership to show the rest of us the direction in which we need to be moving. So there, on the question of hope, like I was thinking, we did a press conference a couple of weeks ago with 7 undocumented workers, who most of whom didn't even cover their faces, to speak out publicly on national media about what this crisis is meaning for them. And it is such a courageous act, and those people are able to provide precisely the solutions that we need, because the people who are the most impacted know exactly what needs to be fixed, and because they know exactly what's wrong. And so if we take this as an opportunity broadly, those of us who are in positions to support folks and have the resources to be able to support, to say this is an opportunity, like there's a crack in the system right now, and we have an opportunity, and we also have an obligation, I think, to be able to pry that open, so that we don't just sit around and wait until COVID ends to say when are things going to get back to normal, but we say that we don't want things to get back to normal, because normal was terrible, and normal was bad for a lot of people, was bad for most of us. And so how do we take advantage of the crack in that system to say we're not going to go back to where we came from, and we're actually going to use this opportunity to go in a completely different direction? And that if we want to do that, that means taking the leadership from those folks who know exactly where we need to be going and how we need to get there. And so all of those things that we talked about, like fully public healthcare systems and universal childcare and free transit and access to housing and all of these sorts of things, right, that we know are important, and that we know that is really possible if we put our minds to it, and we defund the police and we tax the rich, right, to be able to pay for it all. Like, now is our opportunity to make sure that that is the direction that we go in to get out of this crisis. And I think that we have an opportunity and responsibility to do that. And it means taking leadership from those folks who know exactly full well how we should be doing it.
Thank you, Karen. And what an important note to end on. Wow. I just want to say thank you to each and every one of our panelists. That was incredibly rich, but incredibly insightful and hopeful. For me and my colleagues at YWCA, we're deeply grateful, but also we want to work in partnership and solidarity with all the movements that have been represented here today. So we hope that this is the beginning of a conversation and dialogue where we can continue to work in partnership, because all of these crises and all of these issues are interconnected. So our advocacy and our solidarity and our activism has to also be interconnected. So I look forward to continuing to work in partnership with all of you. Again, immense gratefulness for sharing your insights with us today. Wow. So I think that has given us a lot of food for thought. And I think there's a sense of a roadmap that we want to kind of move forward with when it comes to this pandemic recovery. I'm going to ask my colleague Jen, who's been kindly helping with all of the tech and work around this, my colleague. Actually, maybe I'll take this on just so we can have the flow continue. So this, like I was mentioning, this event is part of a series. So our next event is actually happening next week on Thursday as well. It's in anticipation of Mother's Day. And we really want to have a frank conversation about what does care look like during this pandemic. So the information is there. You're going to hear from parents, care workers, and activists on how they're caring for their families and communities during this pandemic, and really delving deeper into that. My colleague Jennifer Lockerbie is going to be moderating that session, and we're going to have colleagues from across the YWCA movement participate, including YWCA Halifax. So that'll be also interesting to hear from coast to coast what is happening during this pandemic. With that said, I think I'll close off the event. Thank you again. This is something that we want to continue to do to build community and build our circle of activists and advocates, because we can't do this work alone. This work has to be done in partnership, and we thank you all for participating with us today. What I want to share is just our contact details. You've already probably received an email from me. I also want to ensure that you have it on here on the screen. I've been seeing throughout this entire session, people have been connecting with us online. Please continue to do so. And if you're working on a campaign or working on an issue that you think YWCA should be a part of or YWCA could support, please let us know. This is why we're here. We want to work in community and work in partnership. So with that said, I want to thank everyone for participating, and I look forward to seeing you in the future again. All right. Thank you,
Thank you so much, Anjum.
Thank you.
Thank you.
Thank you.
Bye, everyone. Nice to meet you all.
All right. So we're gonna close it out now. Perfect. Thanks, everyone.